The topic of this video is about addiction. Addiction, consumption that is detrimental to all people. First, what is meant by the term addiction? Addiction is an inability to stop using a substance or engaging in a behavior even though it may cause psychological or physical harm. Which organs are attacked by addictive substances? And that's the brain, the most vital organ in our body and is responsible for numerous bodily functions such as memory, movement, and thought. What effects does an addictive substance have on the brain?
Every substance has slightly different actions on the brain, but one thing all addictive drugs have in common is that they produce a pleasurable surge of dopamine. Addictive drugs all cause dopamine to flood the reward pathway 10 times higher than a natural reward would. Over chronic use, nothing else natural is quite as rewarding. In fact, as substance use increases, the circuits adapt and reduce their sensitivity to dopamine, a phenomenon known as tolerance. For example, let's say a person takes cocaine for the first time. The reward system receives a huge burst of dopamine. But as the person takes more frequently, cocaine will be overstimulating the brain with dopamine. This will cause the brain to adapt to these chronically high levels of dopamine. To compensate and adapt to this new normal, the brain reduces the number of dopamine receptors available in the reward system and releases less dopamine. As a result, that person will feel the need to increase the amount of drug they take so that they can reach the level of high that they're used to. But it's not just the reward system that's affected by this tolerance, since dopamine is also involved in other brain mechanisms. Other brain regions involving decision-making, memory, and judgment also get physically disrupted as a result. The overall effect is to have drug-seeking behavior driven by habit rather than conscious thought, like a reflex instead of a choice.
So these substances will hijack the brain's reward system, which seeks it addictively despite the loss of someone's moral compass. Addiction only destroys someone's life and community. Those that introduce you to drugs and other addictive substances have no care for anyone.
So along those lines, I've heard you say that in order to reset the dopamine system, essentially in order to break an addictive pattern, to become unaddicted, 30 days of zero interaction with that substance, that person, etc.
Right.
Is that correct?
Yeah. And 30 days is, in my clinical experience, the average amount of time it takes for the brain to reset reward pathways, for dopamine transmission to regenerate itself. There's also a little bit of science that suggests that that's true. Some imaging studies showing that our brains are still in a dopamine deficit state 2 weeks after we've been using our drug. And then a study by Schuckett and Brown, which took a group of depressed men who also were addicted to alcohol, put them in a hospital where they had received no treatment for depression, but they had no access to alcohol in that time. And after 4 weeks, 80% of them no longer met criteria for major depression. So again, this idea that by depriving ourselves of this high dopamine, high reward substance or behavior, we allow our brains to regenerate its own dopamine for the balance to really equilibrate. And then we're in a place where we can sort of enjoy other things.
So that progressive narrowing of what brings one pleasure eventually expands. So